Good afternoon, Namibia. Welcome to yet another edition here at the Government Communications Center. Today, of course, we are going to discuss leprosy treatment, support, and care. My name is Pinasi Pinge, and I'll be your host for the afternoon today. Of course, join me in the studio today to discuss this barbaric disease. I'm joined by Dr. Neta Haitembu, who is the skin doctor here in the Ministry of Health and Social Services. Doctor, welcome to the program. I'm also joining by Sister Apronia Aces, who is also the skin nurse, of course, at the dermatology clinic here, also in Windhoek. Sister, good afternoon and welcome.
Yes, thank you.
All right. Okay. Of course, if we have known leprosy is a very old disease that's been around for some times now, and it is being commemorated on the last Sunday of January. In Namibia, we have already started with leprosy awareness in Zambezi as well as in Kavango regions, and of course, leprosy came a long way with Magda Gadi's death on the 30th of January 1948. So Namibia continued to commemorate the World Leprosy Day throughout all those years, and of course we are saying we are commemorating Leprosy Day on the 5th of February 2021, which is today. And of course the theme for this year is Zero Disability, with a theme of we are working toward to prevent girls and boys suffering from this lifelong disability caused by leprosy. To start off with our interview, Dr. Haitembu, what is leprosy that you're talking about?
Leprosy is actually a condition that is caused by a bacterium called Mycobacterium leprae. It mainly affects the skin and the peripheral nerves, the nerves that go to the skin. It's a long-standing illness, and at the beginning, how it starts, the patient may not even notice anything except a very small skin change that will explain and go into details later. And the disease can actually get so severe by the time patients come to us, it's so worse. And a lot of pictures that we see of patients with leprosy, it's a late manifestation of leprosy. Okay.
But what really caused leprosy, and why is it sometimes being called Hassan's disease?
Like I said, this disease is caused by a bacterium called Mycobacterium leprae. The nation will be aware of TB, which is called Mycobacterium tuberculosis. That's a different type of a mycobacterium, but this one is a Mycobacterium leprae, so it's different. And the reason it's called Hansen's disease, it's actually in honor of the doctor, a Norwegian doctor, who actually identified the bacilli itself long time ago, 18,073, somewhere there. And his name is Dr. Amma Hansen's. I don't know if I'm saying the first name correct.
Every time that we've seen pictures that are associated with leprosy, does the fingers and the toes always have to fall off, or what is the story there?
The disease itself affects the skin, and it goes mainly around the nerves, and that is one of the criteria we use to diagnose the disease at the microscopic level. So now what happens is, when the disease presents itself and it presents to us later at a later stage, or when it's advanced, then that is the time the patients come and they look as if the disease has caused their toes or the nails to fall off. But what happens is the disease itself, it reduces the sensation. When you have the disease, because it causes a lot of inflammation around the nerves, so there is reduced feeling. The patients they actually do not feel that there is something happening to them. Now in that case, what happens is they can easily develop infection without them feeling anything. They can easily develop ulceration or breakage in the skin. If they don't look, they may not actually notice it, and in fact you have no pain. So then what happens is recurrent infection can result in absorption of the bones. And then once the bones are absorbed, the cartilage itself depresses, and then what it appears as if you have actually lost your fingers. Although in some cases, because also of vascular problem, which is blood vessels, that can happen. Then you can actually totally lose part of your fingers, and it can actually look so small. But that is actually because of the complication of the disease, not because of the disease itself. At the early stage, you do not see that.
Okay. Sister, we know what is leprosy now, but what are those signs and symptoms, the common signs and symptoms that I should be on the lookout with for me to go to the hospitals? What are the signs and symptoms of leprosy?
The signs and symptoms of leprosy is unusual spots on the skin, unusual growth on the skin, loss of eyelashes and eyebrows, numbness, loss of hair, um, loss of or decrease in feeling, and many more.
Okay. Doctor, sister just gave us these symptoms, but how is leprosy transmitted? You spoke about the bacteria that caused it, but is it also very contagious?
Leprosy, I would say it's not very contagious, but the way it's transmitted is actually through the droplets that you usually get in the nose. And now, when someone coughs or they sneeze, and you are in close contact with this person, that is when you can breathe it in and then it goes through your system. Yeah.
All right. Sister, is leprosy treatable? Can I get cured if I been diagnosed with leprosy? And are there perhaps some side effects on the medication if I start treatment for leprosy?
Leprosy is treatable.
Okay.
Leprosy can be treated.
Okay.
And when you see these signs, you go to the clinic. The clinic will send you to the correct doctors to treat you. So, what's that?
Yeah. But if I started treatment, can I still pass on to the next person? How long does it take for me not to be infectious, doc?
It takes a week, then you are no more infect the next person.
Okay.
Yeah.
And what is the duration of? You say it takes a long time for one to be cured from leprosy. So what's the duration of that treatment?
6 up to 1 year.
Okay, so you can be on treatment for 6 up to 1 year.
Yeah.
So me taking medication for this whole time, are there some sort of side effects? Me taking this medication, are there common side effects for leprosy treatment when I'm taking this medication? Perhaps, doc.
Yes. Like with any other treatment, really, there could be side effects. And those are side effects that we cannot really predict. Remember the medication that we are using for leprosy? We are also using them in other conditions. And yes, there could be side effect. And we cannot predict who is going to get side effect from leprosy treatment or who is not going to get it. But they are depending on how your body reacts to the medication, which we usually use about 3 different types of medication, the antibiotics, so that we prevent resistance. And it has been known over the years that actually with that treatment, we can cure patients more effectively. There are some medications where the color of the skin might actually change. And that alone, if we don't warn patient about it, they might actually stop treatment. And then for some medication, they change the color of the pee, and that also, patients get very worried about it. So it's something that we have to actually let the patient know right away. Some of the medication can cause a skin rash. They start itching, and then we warn them about these things. And of course, sometimes, in very few cases, but we do monitor that, there is a very small possibility that you could have problem with your liver. But a lot of times, these are just slight changes in your liver function, or no, in your liver enzymes. In fact, I'm getting too technical, but these are things that we pick up. A lot of times, we experience really not much problems with treatment of leprosy. So patients should go on and be treated. In as much as it's taking too long, patients are actually encouraged to go and get treatment because it prevents long-term disability. All these pictures of leprosy that you get, like you were asking me about toes and nails that are getting short, it's because we have not treated the disease properly. And those are long-term complications. But early on in the treatment, we actually cannot get that. If we catch it early and we treat it early, the debilitating disability can actually be totally avoided.
Okay. Well, Namibia, if you're joining us, we are coming to you live here from the Government Communication Center. And of course, we are discussing leprosy treatment, support, and care toward commemoration of World Leprosy Day in Namibia. We have guests in the studio, of course, Dr. Aitembu, who is a dermatologist, skin doctor, and of course, Sister Apronia, who also the skin nurse, a dermatologist who is the dermatologist here with the Ministry of Health and Social Services. And we have Aina Aikuti, who is our sign language interpreter, also with us here in the studio. Doctor, getting back to the damage now, what are the common types of damage that leprosy can cause to a human being?
Okay, once again, I repeat, the most damage that we get is in long-standing leprosy. And sometimes, like I said, we can then get side effect of medication, which is also part of the damage that we get, especially in terms of the skin, so that we have explained before. But the disease itself, then there are different things that can happen. Like we say, the nerves get damaged. Apart from reduced sensation, long term, patients can actually lose the muscle functions, so they get paralyzed. So you find that they might have a foot drop because the muscles now that are the muscles that support the foot, they are paralyzed, so they just get dropped. And then sometimes they can get deformity, especially of the hands, and those are the pictures that we actually see around. And then they have claw hands, and then sometimes they can actually get, especially in males, you might end up with sterility. But more important also, the eyes can get affected. The muscles that help your eyelid to close, now they also get paralyzed. So what happens naturally when you sleep, your eye is supposed to close. But now because these muscles are paralyzed, they do not close. And there's reduced sensation even to the surface of the eye. And then you get small ulceration. That's where you also end up with blindness. But once again, this happens only if we let the disease lurk around in a patient for a very long time.
Okay. Sister, when it comes to leprosy, which areas in Namibia are likely or maybe are common to where we mostly find leprosy as a problematic?
We can find leprosy actually anywhere in Namibia, but mostly in Kavango region and Zambezi region, Comas, Omusati and Oshana region. That's where we found leprosy, but mostly in Kavango and Zambezi.
Statistics shows that we have about 7 cases that we have right now, 2 in Zambezi, 2 in Kavango. Comas also have 2. Omsati and Oshana each have 1 case. But how do we test for leprosy? How do you diagnose leprosy, Doc?
Usually, for a trained healthcare workers, leprosy should be a diagnosis of just clinical observation. You see the patient, then in fact you suspect it. And like the Sister Apollonia explained, you look at the skin signs that you get, and then reduce sensation. Not all the time it is there. So the healthcare workers actually have to suspect that it could be leprosy. And unfortunately, because it's becoming rare and rare, it's almost like out of sight, out of mind. But leprosy is there. And then the final diagnostic test that you can do, you can actually take part of the skin from the patient, you send it to the laboratory, and then they look under the microscope to see the Mycobacterium leprae in the skin, and they look for the signs that actually imply that this could be leprosy, where you really have a lot of inflammation around the nerves. There are other ways also where you just take a fluid that we call a lymphatic fluid from usually around the earlobe, and then you look under the microscope and see also if you see the bacilli. But
Can you say we are doing enough to pick out all those cases out there? Do you feel all the cases that we should have picked up in the country, we have them on record? 7 cases for the country.
that's a tricky question, but most likely, no. Because like I said, it's almost like it's out of sight now, it's out of our mind. A healthcare worker has to actually think about it. And somehow I'm thinking, with awareness, we all human. If a patient is having some suspicious lesions and they go to a healthcare workers, if at the back of their mind they think, could this be leprosy? I don't think there's anything wrong with asking a healthcare worker that I'm actually concerned about leprosy. Because sometimes a patient comes to you and it's not the first thing that comes to your mind. The problem with leprosy, especially on the skin, how it presents, many other conditions can present like that. So you have to suspect it. Do you understand? It's almost like it's seeing you and you're not seeing it. So you really have to be on the outlook for leprosy. So to answer your question, I think there could be cases that we are actually missing. And worldwide, it has been found that case finding, like individual cases, that has not really been changed over time. So leprosy is there. So we just have to be on the outlook for it so that we prevent those debilitating disabilities. Yeah.
Sister, from our conversation, we are learning that if you don't treat leprosy or if you don't pick up leprosy at the early stage, it may cause disability. So what are the services made available by the Ministry of Health and Social Services for the patient who are on treatment? Is there provision of the services available for those who have started taking their leprosy medication? How is the ministry assisting them?
The ministry is educating the community to help these people which is on treatment, for them not to start the treatment in between or not to finish the treatment. The community must, when they held meetings, talk about this, especially when it is leprosy week. They have to discuss this in their meetings. So we must not stigmatize the person which is on treatment, because any one of us can get leprosy. Leprosy is not for specific people, it's for all of us. So you don't know when is your time. And the other thing is disability. We must prevent it with early treatment for the person not to become disability, as doctor has mentioned, from the nerves which is becoming numb and everything like that.
Now, if I find myself having some of the symptoms that you have just mentioned to us now, sister, where can I go and get assistance? Where are the services available?
If you see these symptoms or notice them, you are free to go to any GRN clinic. They are nearby and they are accessible. And they will help you.
Doctor, you spoke about awareness. This brings me to the fact that the Ministry of Health and Social Services cannot do this on their own. How would you like the other key stakeholders to come on board to help the Ministry of Health to eliminate leprosy one day? So what is expected from the outside world, apart from the Ministry of Health?
From outside world or
from the outside community, from the other partners, stakeholders? How would you want them to come in and assist the Ministry of Health to eliminate leprosy?
Elimination of leprosy, like by definition, we want it to be one case per 10,000 population. One, or in fact less than one. Do you understand?
Yes.
We want it less than one. It becomes very difficult, but what the community can do, or other good-willing people, when they want to donate anything, we've got patients with leprosy, first of all, because they're the one who are transmitting the disease. We've got cases where some of them are not even able to get to the centers where they can get medication. You understand that we want to actually give it like observed treatment, which is better. Because then, the patient has to take about 3 medications per any given time, and they have to take it for a very long time, like every single day. And the treatment, even when we say it is 6 months, to 1 year. I would like to say the end point of treating a patient with leprosy is actually very difficult to determine. This is the end of it. And we have different guidelines that we can follow. Some that says 12 months, some that says 24 months. So the clinician, you have to decide. Now imagine. So where the healthcare workers or anyone can come in to assist us, those who actually have the disease, we need to support them emotionally. And sometimes we just need to be there for them to be kind of treatment supporters or a partner that supports this person. You go to the clinic every day, then we go together. Do you understand? Sometimes even just giving them food. And those who have disability, now for example, your hands are affected, you cannot see anymore. You can see we need even more other stakeholders to help us. If a person is not able to see, then we have to deal with the person now who is blind. Do you understand? If the person's hands are deformed, then we need to get someone who can help them do day-to-day work. Do you understand? So literally everyone can come in and see how they can assist. And the most important thing is we can share information. Even at church, this can be shared. Even at any other meeting, we can share this information, and we must just let everyone be aware of the fact that leprosy is nobody's fault. It can happen to anyone. So you can assist whenever you can. Like I said, it's not so many people, but those who are affected, we really have some of them that are severely affected by this. And it's high time that someone can just, whatever little that you can do for that person will change a person's life. Do you understand?
Okay. Coming back to the commemoration of Leprosy Day now in the month of February, what is happening in 2021 for leprosy commemoration in Namibia? What are we doing?
The Ministry of Health this year have taken a different stand, which is good, because before it used to be speech, we observed the speech about leprosy and how do we treat it. But this year they took a different approach altogether to actually give out information, to actually, especially in the Zambezi region, where we have the highest number of cases, they are busy interviewing patients, either those who are cured or those who have the disease itself. So it's more active awareness this year compared to before, which is very good to the ministry. Yeah.
We are getting to the end of our interview. Sister, any last words to the audience out there? What would you want to tell the leprosy patient out there on the entire Namibian community?
What I would like to say is, for our leprosy patients, not to feel stigmatized and stop the treatment in between. And what I want to say to the community is, let's assist these people. Let's help these people to run their race with our support. Let's support these people in any way we can and assist them. That's what I can say.
Okay. Doctor, any last word? Let's wrap up.
Yeah, I agree with Sister Apollonia, what she said. Leprosy is nobody's fault, so we support each other. And to the fellow healthcare workers, let's be on the lookout for leprosy because it's there. And for the community, if you see anything on your skin that you're suspicious about, please feel free to contact any clinic in the country, and don't shy away from asking or raising the concern that you could be leprosy, because it might as well be, and the healthcare worker has totally forgotten about the existence of that disease or just didn't think about it. And
well, Namibia, with that, we have come to the end of our discussion for today. We were discussing about leprosy treatment, care, and support. And of course, to my guests, thank you very much for being part of this very interesting topic. And let's be on the lookout for the signs and symptoms. And from all of us here from the Communication Center, it's good afternoon.